Clinically, these patients tend to follow a pretty recognizable pattern. So the headache itself is usually described as really severe, throbbing or pulsating, and it's usually going to be unilateral, so only on one side of the head. Your patients are you're usually going to be really sensitive to light, which is photophobia, or really sensitive to sounds, which is phonophobia. They might also have some associated symptoms like nausea and vomiting. Again, it's going to be all patient dependent. Sometimes these patients might describe an aura, which is like a transient neurological symptom that usually develops gradually over several minutes, and then that'll resolve on its own, usually within a few hours. So sometimes these might be visual auras where the patient will describe flashing lights or zigzag patterns in their vision. Sometimes they even describe blurred vision. But sometimes these patients will even describe sensory auras, which are things like numbness and tingling in the fingertips that work their way up into their arms and shoulders. Migraines, again, can last anywhere from a few hours to a couple of days. And after that, we go into the postdrome phase, or the hangover, where the patient still might feel fatigued or mentally fogged, even after that migraine has resolved. So if you're transporting this person, you can think of POUND, which is a good mnemonic to help you remember migraine. It's pulsating, onset, unilateral, nausea, and debilitating. That's a good mnemonic for these patients with migraines.